You know, my friend, there's something I've learned after more than 6 decades in medicine. Not every health test that's offered to you is actually good for you. In fact, some of the ones we're told to do every year, without question, can quietly steal our peace of mind, drain our savings, and sometimes even harm our health. I've spent my life as a physician here in the United States, caring for thousands of people well into their 70s, 80s, and 90s. And at 88 years old, I still see how the system can nudge us toward expensive, high-tech screenings that benefit hospitals more than they help the patient. I remember one dear patient, a perfectly healthy woman in her late 60s, who went in for one of those comprehensive checkups. The scan showed a tiny spot in her brain, something that, medically speaking, was harmless and common at her age. But once she heard it, fear gripped her. She began to worry day and night, stopped enjoying her daily walks, and spent months going through more tests she didn't need. It wasn't the spot that hurt her, it was the fear the test created. And that's why today, I want to share with you the truth I've gathered from a lifetime in the clinic, which tests truly protect your health after 60, and which ones you can safely skip. If you listen with me for a few minutes, you might save yourself thousands of dollars, hours of unnecessary worry, and, most importantly, protect your peace of mind. So, pour yourself a cup of tea or coffee, settle in, and let's have an honest talk, one friend to another, about the health checks you really need in your golden years, and the ones you don't. 1. Colonoscopy, your life-saving look inside. Let me tell you, my friend, the colon is a tricky part of our body. It's like a quiet neighbor, you don't hear a peep until there's real trouble, and by then, the problem may have already moved in for good. That's why a colonoscopy is one of the very few tests I consider truly essential once you hit your 50s. It's the only way to spot polyps, those little growths that can quietly turn into cancer over the years, before they cause any symptoms. First, here's the sobering truth: colon cancer is one of the most common cancers in older adults here in the US, but it's also one of the most preventable. If you catch it early, your chances of complete cure are over 90%. That's not a wish, that's decades of medical evidence. And here's the beauty of it: polyps usually take 5 to 10 years to turn into cancer. That gives us a big window to find them, snip them out, and move on with our lives. I think of one gentleman I cared for. He was 71 and felt perfectly fine. During his very first colonoscopy, we found a growth about the size of a grape. The lab said it was already starting to become cancerous, but because we removed it right then and there, he didn't need chemo, radiation, nothing. He told me later, "Doc, I never thought sitting through that prep drink would save my life." We laughed, but we both knew it was true. Now, you might be wondering, how often do I really need this? Well, the general rule from our gastroenterology folks is to start at age 50. If everything looks good, repeat every 5 years. If they find polyps, you go back sooner, maybe in 1 to 3 years, depending on size and number. Even past 75, if you're in good health, it's worth continuing. But after 80, it's a personal decision you should make with your doctor, weighing the benefits against the risks. For myself, I stopped at 90, but only after years of staying on top of it. And yes, I've been through it too. At 75, they found a small polyp in me. We removed it, and I went right back to my morning walks the next day. No doctor is immune, and that's exactly why I speak so strongly about it. Bottom line? A colonoscopy isn't just another test, it's your chance to outsmart one of the most dangerous, and yet most preventable, cancers we face in our later years. 2. Upper endoscopy, catching stomach trouble before it catches you. Now, let's head a little higher up the digestive tract and talk about the stomach. You might think, well, I'm eating fine, no heartburn, no belly aches, why would I need anyone poking around in there? That's exactly what many people say, until an endoscopy finds something they never saw coming. Here in the US, stomach cancer isn't as common as in some countries, but when it does happen, it's sneaky, no clear signs early on, and by the time symptoms show up, it's often already advanced. The good news? If you find it in the early stage, the survival rate can be 95% or higher. That's as close to a win as medicine gets. An upper endoscopy is simple in concept. it's a small camera that takes a look at your esophagus, stomach, and the first part of your small intestine. With today's sedation, you'll likely nap right through it and wake up asking, "Where are we starting?" only to hear, "We're all done." And it's not just cancer we're looking for. This test can spot ulcers, inflammation, acid reflux damage, even the bacteria that cause long-term stomach problems. I once had a patient, Mrs. Thompson, who was 67 and came in for a routine screening. She felt great, no indigestion, no pain. But during her endoscopy, we found a tiny early-stage tumor. We removed it before it could spread, and she's been living life to the fullest for over a decade now. She still sends me a Christmas card every year, reminding me how that one test gave her bonus years. Most guidelines here recommend starting around age 40 for those at higher risk. Say you've got a family history of stomach cancer, chronic acid reflux, or certain precancerous conditions. For most folks, though, we talk about it in our 60s if symptoms appear, or earlier if your doctor sees reason. And if something risky shows up, like precancerous changes, you'll probably be checked every year. Past 80, it's a decision you make together with your doctor, based on your health and how much you'd benefit from finding something early. So, why do I put upper endoscopy on my must-consider list for older adults? Because it's a rare tool in medicine, it can actually stop trouble before it starts. And in my book, that's worth a short nap and a light diet the day before. 3. Heart ultrasound, useful in the right hands, but not for everyone. Let's talk about a test that sounds harmless enough, the heart ultrasound, or echocardiogram. It's a wonderful tool when you need it. It uses sound waves to take a moving picture of your heart, showing how well it pumps, whether the valves are working properly, and if there are any unusual changes in the muscle. When you've got chest pain, shortness of breath, an abnormal EKG, or a known heart condition, it can be life-saving. But here's the thing, if you're a healthy older adult with no symptoms and no heart trouble in your history, this test can do more harm than good. First, it's not cheap. Without insurance coverage, you could be looking at hundreds of dollars. Second, it often finds small, harmless changes that are simply part of normal aging. And once you hear the word abnormal, even if it means nothing dangerous, it can plant a seed of worry that's hard to shake. I remember a gentleman named Mr. Reynolds, 67 years old, came in for a comprehensive checkup package. His echocardiogram showed mild valve thickening, a completely normal finding for his age. But after hearing the result, he became convinced his heart was failing. He cut back on exercise, avoided travel, and spent months going from specialist to specialist. In the end, everyone agreed, his heart was fine. But by then, the fear had already robbed him of part of his life. Even I have turned down the test when it wasn't needed. At 80, a clinic tried to bundle it into my annual checkup. I felt fine, my blood pressure and EKG were normal, so I passed. Instead, I stuck to the real heart protectors, walking every day, eating well, and keeping my blood pressure under control. The American Heart Association and the American College of Cardiology agree, if you don't have symptoms, family history, or known heart disease, routine echocardiograms aren't recommended. They're best reserved for when there's a clear reason, chest discomfort, unexplained fatigue, irregular heart sounds, or changes in an EKG. So my advice? Think of the echocardiogram like a fire extinguisher. If there's smoke in the kitchen, grab it right away. But if the stove's cold and the air's clear, you don't need to pull the pin, just keep cooking healthy meals and enjoy your day. 4. Brain MRI and MRA, amazing technology, but not a routine check for the healthy. Now, let's move from the heart up to the brain. MRIs and MRAs are truly remarkable machines. An MRI gives us a detailed look at the brain's structure, while an MRA focuses on the blood vessels. They can spot strokes, aneurysms, tumors, things we couldn't have imagined detecting so clearly just a few decades ago. When you have sudden symptoms like weakness, slurred speech, vision changes, or severe unexplained headaches, these scans can be life-saving. But here's the truth, if you're healthy, have no neurological symptoms, and your memory and thinking are steady, getting one just to see often causes more trouble than it prevents. First, the price tag can be jaw-dropping, hundreds, even thousands of dollars without insurance help. Second, these scans often find little spots or changes that are simply part of normal aging. They don't cause any harm, but the minute you hear something abnormal, it's easy to start imagining the worst. I once saw a patient, Mrs. Olson, 76 years old, who had a brain MRI included in an expensive health package. The scan found a tiny aneurysm, so small and low risk that no treatment was needed. But from that day on, she felt like she was walking around with a time bomb in her head. She stopped traveling, gave up her morning walks, and even avoided being alone in case it burst. It wasn't the aneurysm that changed her life, it was the fear of it. I've been there, too. At 85, I had a brief dizzy spell, and my doctor ordered an MRI to be safe. Lying still inside that narrow tube for over half an hour wasn't pleasant, even for someone like me who doesn't mind tight spaces. I thought about how much harder it would be for someone with even a touch of claustrophobia. Fortunately, my scan was clear, but I remember thinking, I'm glad I only did this because we had a real reason. Professional guidelines here in the US, from the American Academy of Neurology to the American Stroke Association, agree. Brain MRI and MRA should be reserved for people with specific symptoms or clear risk factors. If you suddenly have trouble speaking, weakness in your face or limbs, a sudden severe headache, or unexplained changes in memory, yes, get the scan quickly. But if your brain is working fine and you have no warning signs, you'll protect both your wallet and your peace of mind by skipping it. Think of it like calling the fire department. If there's smoke pouring out of your house, you want them there instantly. But you don't call them every week just to check if the walls are still standing. 5. PET scan, powerful for detecting cancer, but not a test for just in case. Finally, let's talk about one of the most high-tech scans out there, the PET scan. In medicine, it's a marvel. It uses a small amount of radioactive sugar to light up cells in your body that are unusually active, often cancer cells. It can help doctors see where cancer has spread, check how treatment is working, or even look for certain brain and heart conditions. When you already have a diagnosis, or when symptoms strongly suggest something serious, it can be an invaluable tool. But here's the catch: for a healthy person with no symptoms and no cancer history, a PET scan is almost never the right choice. First, the cost is enormous, often $1,000 or more out of pocket if insurance won't cover it. Second, it exposes you to a much higher dose of radiation than a regular X-ray, dozens of times more. And third, it's surprisingly good at finding things that look suspicious but turn out to be nothing. That can lead to more tests, biopsies, and weeks of anxiety for no real benefit. I remember Mr. Carter, 73, who bought one of those premium checkup packages that included a PET scan. The scan showed a tiny spot on his thyroid that was taking up a bit more sugar than usual. It sounded ominous, so he went through weeks of worry, several specialist visits, and a biopsy, only to learn it was completely harmless. He told me later, "Doc, I lost more sleep over the test than I ever did over my health before it." I've seen this story play out again and again. In fact, when PET scanners first arrived in hospitals decades ago, we doctors were so impressed that we ordered them for almost anyone with a question mark in their chart. It didn't take long to realize that, especially in older patients with no symptoms, the false alarms were far more common than life-saving discoveries. Most expert groups in the US, including the American Society of Clinical Oncology, recommend PET scans only when there's a strong medical reason. You already have cancer and your doctor needs to know how far it's spread, you have unexplained weight loss or fevers that other tests can't explain, or another scan has shown something suspicious that needs clarification. So, think of the PET scan like a searchlight. You use it when you know there's a target out there, not to sweep the empty sky every few months just in case. For most healthy older adults, the better investment is in screenings that are proven to save lives, like colonoscopies and mammograms, paired with healthy habits that keep trouble from showing up in the first place. So there you have it, my friend, 5 tests every older adult hears about, but only 2 that most of us truly need on a regular basis. A colonoscopy to keep an eye on the colon, and an upper endoscopy to protect the stomach. Those can catch trouble early, long before symptoms appear. The other three, heart ultrasounds, brain MRIs and MRAs, and PET scans, are remarkable tools, but only when there's a real reason to use them. The real lesson I've learned after decades in medicine and nearly 9 decades of living is this: more testing isn't always better. The best care is personalized care, choosing the right test at the right time, for the right person. Too many unnecessary scans can rob you of peace of mind, waste money, and sometimes even cause harm. Your health is not built in the hospital, it's built at your kitchen table with healthy meals, in your neighborhood with daily walks, and in the company of friends and family who lift your spirit. Tests have their place, but they're just one piece of the puzzle. So, before you agree to that next comprehensive checkup, pause and ask, do I really need this? Will it change how we take care of me? And if the answer isn't clear, have an honest conversation with your doctor. We've only got so many days ahead of us, let's spend them living well, not sitting in waiting rooms worrying about things that may never happen. Here's to wise choices, steady health, and a peaceful heart in the years to come.